This podcast is for informational purposes only and does not dispense medical advice. Always seek the advice of a physician or other qualified health providers if you have any questions regarding a medical condition. Never disregard professional medical advice or delay in seeking such advice because of something you have heard on this podcast. Welcome to a show that we like to call Prostate Cancer Real Talk. Did you know that in the U.S., 1 out of every 8 men will be diagnosed with prostate cancer during his lifetime? 1 out of 8. And black men are 50% more likely to develop prostate cancer in their lifetime and twice as likely to die from the disease. But hey, we're not here to quote statistics and tell you how tough prostate cancer can be. Rather, we are here to create a supportive community of survivors, a place where we can discuss the real-life coping methods from the perspective of a married couple who are living through it day by day. Our hosts, Elle and Shay. This is Prostate Cancer Real Talk. Today's show is a special episode featuring our hosts themselves, Elle and Shay. We received many emails from our listeners, so we thought it would be interesting to discuss some of their most frequently asked questions regarding intimacy after prostate cancer. Elle and Shay, take it away.
Thank you very much for that great introduction, as usual, Dennis. This is Elle, and I'm here with my wife, Shay. And as Dennis said in our opening, we thought that it would be a great topic to go through some of our most frequently asked questions. Prostate Cancer Real Talk podcast started about 3 years ago, and we've had a great opportunity to meet with a lot of or interview a lot of doctors, surgeons, patients, family counselors, people from all walks of life, and people that are really interested in the prostate cancer topic. And over this time, we've had many, many questions come in. So what we did, Shay, was to go through those questions and come up with some highlights, if you will, or some of the most frequently asked questions. So Shay, let's jump into this.
So the most questions that we got was always about intimacy. And so, but today we're going to start out with asking you one of the questions that we also received was, when were you diagnosed with prostate cancer and what was your initial reaction?
Okay, so I was diagnosed in the spring of 2020. So during a routine prostate screening, PSA screening, it was seen that my PSA levels were high. They had increased. I was going every 6 months for a routine examination. And over that time, I just, became a normal thing. Just go and almost like getting an oil change with your car. But this particular time was in the spring of 2020. My urologist came in and told me that my levels were increased. So I came back. He told me to come back in 3 months, and I did. And the increase had gone up. And so we did a biopsy, and the biopsy came back positive for prostate cancer. And that was probably around June of 2020. And so after discussing with you, we decided to have surgery. And the surgery was conducted in August of 2020. And so that's kind of the beginning of the prostate cancer journey.
So did you have a reaction when that's the second part to the question was, what was your reaction?
Okay, so, wow. The first thing I can remember is shock and unbelief. All right. You hear people getting diagnosed with illnesses, cancer and other illnesses. But when it actually comes down to the doctor sitting down with you and telling you personally that you have prostate cancer, it's shocking. So the first reaction is shock. I really couldn't believe that this was happening to me. And then it came in the denial. I didn't believe it. I couldn't believe it. And so I'm thinking this has got to be some kind of mistake. You never think something like this is going to happen to you. So what happens is you become an internet junkie, and I started looking online looking for all the different reasons why this can't be happening to me. Is it a misdiagnosis? How trustworthy is the PSA exam? You just look for every possible reason to tell yourself that this can't be true. And so that's the denial part. And then, some people experience anger. I did not experience anger. What I experienced was concern. My concern was for myself, but was also for you. I remember having a real difficult time figuring out, how am I going to tell my wife that I have prostate cancer? That is a conversation that you can never prepare for. And so, I had to kind of really figure out how I was going to tell you. And thank God your reaction was very, very supportive. You didn't panic. You didn't freak out. And so that was helpful. And then, I was afraid. You become fearful. What's going to happen? You just don't know what to do. And then finally, after you go through all these various stages of getting this kind of news, then you accept it. This is a reality. So now what am I going to do about it? So that's the kind of thought process that I went through when I was diagnosed with prostate cancer.
I would say for me, because we discuss often on the podcast that prostate cancer is a couple's disease. So for me, I had similar emotions or reaction that you had. I was never angry. I didn't get, there was no anger there. I was never angry, but I was in complete, total denial and shock. I think we had a family counselor on, remember, on one of the episodes, and Dr. Francis, and he talked about the Elizabeth Kubler-Ross grief cycle. I had never heard of that before. And there's 5 steps in that cycle. And I would say that I experienced 3, which was denial and bargaining. Because when you were diagnosed, if you remember, I said to Dr. Kundu, who was your surgeon, can I just take him home and give him a lot of garlic? Because I have a 80-something-year-old aunt, and she says that garlic cures everything. So I'm like, oh, no, let me just take him home, and I'm going to give him a lot of garlic. I'm going to put garlic in the smoothies. I'm going to put garlic in the salad. Like everything that you ate, I was going to put garlic in it. But, of course, he told me, that was not going to rectify the situation.
I'm not overly disappointed about that.
What? Oh, so you would prefer surgery over garlic?
Yeah, I don't know about a garlic smoothie.
Well, I was willing to try anything. And so, of course, after he said, that was not the answer, then I, went into the last step of the cycle, which is acceptance. And a part of that with Dr. Francis, when he was on the episode, that we all have things that we don't want. So everyone has something, we have it, but don't want it. And so for me, that was sort of like what we were experiencing. It was something that you had, but we didn't want it. And so we had to accept it. And we moved on and, we made the decision and you had the surgery.
If you go down through Elizabeth Kubler-Ross's progression, the first one is denial. Oh, no, I don't believe this. Mm-hmm. And the denial is an attempt to protect the self from having to deal with the reality. So they go through the denial part, and then there, after you go through that kind of then there's this kind of anger. Now, the anger could be based on a number of things internally and externally. So, socially, there is, you go through stuff like bargaining, you start to bargain with God or with yourself or your higher power, your spirit, say, well, listen, the part of bargaining is What can I do to change my lifestyle? That's a part of the bargaining process. What can I do? What have I done? How did I get this? Is this thing hereditary, And if it is, I'm not going to give up. So how am I going to, a part of my bargaining process is change my lifestyle. There's a lot of things you have to change when you change your lifestyle, But the first thing about changing your lifestyle is this: you have to change your view of yourself. I'll probably talk about that a little bit more too. So you change this lifestyle. It's part of the bargaining process, and then and then there's the anger, and then there's the acceptance. And what happens here is this: you come to the conclusion that there is an unwelcomed guest in your life. You didn't raise your hands for it. You don't want it. And this is what I call have but don't want. We all have things in our lives that we have but don't want. We have to battle with those things. And just because we have something that we don't want, it doesn't mean it's going to get up and go away. It doesn't mean that we have, this answer like right now to that. So we have to, we're talking like this, that's an existential stuff. My existence is at stake like right now. Have but don't want. Where did I get it? How do I mitigate it? How do I get rid of this? How will this thing I have but don't want, how will it change me, the bearer, the symptom bearer? How will it change me?
I was going to say something about this experience and related to life. And as you know, I have an athletic background, and I liken it to, winning and losing. And I always say that it's easier to win than it is to lose. People are really happy and accustomed to things going well day to day, but sometimes things come into your life that you're just not prepared for, and illness is one of them. And in this particular case, prostate cancer. And so after, I went through these various stages, as you mentioned, and got to the level of acceptance. And the other thing that happened that was good for me was your reaction and your level of acceptance. And so we said, okay, what are we going to do about this? After we went through the surgery, after we went through the recovery and everything, we decided to take a loss and to turn it into a positive. Since we went through so many different things that people weren't prepared for, that we weren't prepared for, we took the opportunity to start this podcast to share with other people the various things that we went through in order to help them understand and give them the tools and equipment emotionally, informationally, and in other ways where they can hear from other people that have actually gone through this. Part of the process is you sort of feel isolated. You think you're the only one, but you are not the only one that's dealing with this. There are other people that are dealing with this. What we did was to take that challenge and turn it into a positive experience. And I will say one other thing, and that is, it is a great example of the power of getting a PSA test regularly. And that was one of the key things that we talk about on this podcast. PSA exams, PSA screening is so important. So thank God I was getting regular screening. My condition was discovered in a very early stage with my great medical support at Northwestern Hospital here in Chicago. We were able to deal with it, and we did it surgically.
The PROMISE Registry is an exciting new partner of Prostate Cancer Real Talk. PROMISE is a registry of prostate cancer patients who want to learn how their genetics can affect their treatment options. To learn more, visit prostatecancerpromise.org.
So our next question is, Okay, you often talk about having surgery. So the listeners know that you opted for surgery versus radiation. So how long did it take you to recover after surgery?
As far as the social activities and getting out and about and getting out of the house, I think we went out for dinner the next week. Was it?
Well, yeah, they said the question is, how long did it take you to recover after surgery? So I think they're basically asking, like you're saying, like maybe like socially getting out and about.
So I think probably 2 weeks or so. I was able to get back out of the house. Of course, you are wearing.
Well, I'm sorry, I must stop you there. No, so listeners, my husband is a very unique individual. So when you come home from having surgery, prostate cancer surgery, you will come home with a catheter. And we were home on the third evening of Elle being discharged from the hospital. We were sitting, it was one evening, and he said, "Honey, would you like to go to dinner?" And I'm looking at him and I'm saying, "You have this catheter. How are you going to go out to dinner? We can't go out to dinner." And he said, "I'm going to have on pants. No one will be able to see it." So what did we do? We went out to dinner. And this was the third evening after we came home from the hospital. So Elle is very unique. I'm not saying that will be everyone's situation, but I have a very unique husband.
Well, this to me is a demonstration of just being positive about this whole thing and not letting it get you down. It's happened. Okay, it's happened. You can't undo it. So what are you going to do about it? And as I mentioned earlier, it's easy to win, but what are you going to do when you lose? How are you going to handle that disappointment? How are you going to handle that medical condition, that diagnosis that you got? So, you can either let it beat you or you can beat it, or you can fight it. And that's what we decided to do. And that's what I decided to do. And that's what, with your support, we were able to turn a negative into a positive. So now we have the opportunity to help other people. I always tell, the folks that I meet, I have a background in media, and with my background in media, with the diagnosis that we have, it just enabled me and prepared us to carry forward with this podcast. And the main thing is helping other people.
All right. And our next question is, and this is the main question. We decided to do those other few questions before we got to the main one. I would say that 90% of the questions that we get are all sex related. Is sex the same after surgery?
The answer is no. Honestly, I'd love to be able to tell you that it's better, okay, but it's not. It is somewhat of a challenge. You still can have a physical relationship, but there's a difference. And I'm glad we're gonna get into this a little bit more. But there are things that men can do to help in that area, and we're gonna actually get into that with a video that I believe you're gonna show, Shay. But the answer is no.
Okay, but it still can be fulfilling.
Correct.
Yes.
Correct.
Yes. It's not what we would say the same, but it can be fulfilling. And I would say to the listeners and, wives, if you're listening, or, men, and if you're considering, or you're a patient, or you recently been diagnosed with prostate cancer and you're saying, and you've, elected to have the surgery, I would say, and I'm just being very honest, get as much sex as you can before the surgery, because it's going to be a while. So, that was kind of like what Elle and I, that's what we did. We're like, hey, let's get it in, because we don't know how long it's going to be, post-surgery before it can happen again. So it can be fulfilling, but it's not quite the same. And we're just being, we're Prostate Cancer Real Talk. So we're just being extremely real and very honest with you guys, with the listeners. It's not exactly the same, but it can be fulfilling.
Mm-hmm. And I'm glad you mentioned that, Shay, because a lot of times I talk to guys and they don't know all the intricate details about it, but they've heard that it does make a difference in your sex life. And for that reason, many guys will forego having the surgery or radiation or treatment at all because, they don't want their sex life affected. But, if you're not alive, you can't have sex.
So how does prostate cancer treatment affect sex and intimacy? Well, the most common side effect, whether we take out the prostate with surgery, whether we irradiate the prostate, or whether we use hormone ablation or a combination of these things, is difficulty getting and keeping erections, which is erectile dysfunction. Also, ejaculation changes. If we remove or we radiate the prostate, that's where the fluid comes together that is ejaculated out during ejaculation or climax. So men still climax or ejaculate, but nothing comes out after surgery or radiation typically, or very little comes out. So it may still feel good. It may still be enjoyable. Most men definitely can still climax, orgasm, ejaculate, but the fluid no longer comes out, and it can affect that experience. And certainly that can be different when fluid is not coming out. The penis may sort of pull back in the body and disappear sort of after surgery because of increased muscle tone initially. But sometimes if you don't eventually get erections, muscle atrophy can occur and problems with erections. So all these things can impact men and it can impact their partners.
I wondered, about the status of the relationship. Of course, I had heard that, it was going to have a physical impact. A sexual impact, and I did not know. I don't say I didn't know. I knew Shay would stick with me. I felt that she would stick with me throughout whatever, but it still comes into your mind. It's kind of like, man, this is a lot for me. And I think one of the things that we talk about frequently on the podcast is, when you're talking about prostate cancer, there's a whole lot of discussion about the impact that it has on the male or the initiator of this sexual experience. But the partner also has a significant impact on them. And I don't think that people talk about that enough. It just really requires a tremendous level of unselfishness.
Just a reminder, to ensure that you stay up to date on the latest episodes from PCRT, don't forget to hit that subscribe and like button.
Okay, will surgery affect my intimate relationship with my partner?
Okay, so the difference between sex and intimacy, okay? You can have intimacy without sex. You can, have intimate relationships with your partner. It may not always be sex related. So the short answer that it is going to make a difference in your physical relationship. It is going to make a difference. But there are things that men and their partners can do to mitigate that. There's treatments. There's just, on a whole assortment of things that can be done to help in that area. And I do believe that, we're going to get into that with the video that you're going to play. But yeah.
We cannot ignore the fact that your relationship will change because you're going through cancer treatment. We can't ignore the fact that this will have an impact on your partners. And so even how you tell your partners who you talk to is a big deal. So I always try to encourage men to bring their partners in, or their trusted family member or support person, sometimes it's their best friend, into that meeting. So that someone will hear you, hear the doctor give this information and actually can absorb some of it. Take notes even, right? So that you can know what that doctor said. Because if you hear cancer, most men are like a deer in headlights. They only heard cancer. They didn't hear me tell them about the sexual side effects. Part of men's difficulty in telling their partners that I have prostate cancer is, you expect me to be around for you until you're old and ready to die, and I can't promise you that, right? That's a big hit to your role as a protector provider. I think sexually, sex plays a big role into relationships, intimacy. Mm-hmm. And I think there's a big need for people to be able to redefine what intimacy looks like after prostate cancer treatment, because even the anxiety or stress of going through it can make erectile dysfunction happen.
Hey guys, this is El. Did you know that during the treatment of prostate cancer, our genes may be our most powerful tool? That's why the PROMISE Registry was formed, and that's why I joined. To learn more, go to prostatecancerpromise.org. That's prostatecancerpromise.org.
So when you're sitting and you're giving them that, dreaded, diagnosis, oh my God, I'm sorry to say, but you have prostate cancer. Do you explain to them, or do they understand in that moment their potential side effects from having prostate cancer? And if they do, is that a determining factor or part of their decision-making process as to whether they're going to have the surgery or not?
The answer is all over the place, Like there are people who had a family history or a friend who had prostate cancer, and so they are much more aware of what the prostate is. I go to churches a lot to do talks pre-COVID, and most men don't know that it's not a prostrate. It's a prostate.
Yeah.
And I'm not just saying black men, I'm saying men across racial groups. Uh-huh. They can identify on their body where a woman's ovary is, where the uterus is, and where the cervix is before they know what their prostate is. And they definitely know what those organs do in a woman much better than they know the prostate's function in themselves. And I can't figure out why that is. I think we're very motivated to know about women's health for our own sexual needs, if we're straight, or we also are motivated to probably avoid baby making. And so we, try to figure out what's going on, right? I know men who can count their woman's cycles, but they don't know what their prostate is.
Mm-hmm. Do they make that decision about surgery knowing the potential side effect, that it could be some sexual dysfunction, or there could be a while before, you're listening to Marvin Gaye again?
Are they aware of the sexual side effects when they're making this decision? It's our urologist's job to do that work, right? So I draw a lot of pictures. My clerks make fun of me because I'm always drawing pictures about where the prostate is and what it does and how it connects to the bladder and urethra, and the nerves come in right next to it for erection, to help them understand the basics of what surgery does, what radiation does, and what a biopsy is really doing, right? So that they get what just happened to them. So if someone forces me, I'll try to figure out for them what their priority is. Is your priority in life the number of years that you live, the quality of life in terms of sexual performance, or the quality of life in terms of urination and kind of feeling your best self energetic-wise? Are you forming a new relationship with someone where you need your sexual function for the next few years? A lot of single guys out there who get prostate cancer diagnosis and they're dating someone new after a divorce or whatever. I don't necessarily recommend surgery for those folks if they need more time to cement their relationship with their new partner, because sexuality and intimacy is a big part of that. And I can throw a monkey wrench in. Mm-hmm. So I try to figure out what their priorities are. And then I still end up sometimes giving my recommendation, and I will rank them. Here are your 4 options. I would rank this 1 for this reason, this 2 for this reason, this 3 for this reason. This is my last choice for this reason.
Don't forget to subscribe to our YouTube channel and like this video to keep seeing more content like this from us. It will also benefit YouTube's algorithm, helping to introduce our content to others who may need it most.
Thank God for you. That's all I have to say. I have an understanding wife. You mentioned that I was unique. I think you're unique in that way as well. Very, very supportive. which is one of the reasons why we got married. It's one of the reasons why I asked you to marry me, because I knew I could tell how supportive you were when we first met. And as the time has gone on, that support has just gone way, way, above. It's grown through the years. So there you go. And I also want to add, we are people of faith. And when something like this happens, I feel like it gives you the opportunity to say, everybody says, oh yeah, I have faith, I have a spiritual background, and you hear people say that. But when something like this happens to you, it says, okay, now prove it. You say you're a person of faith, prove it. All right. And I will say that, our faith has sustained us, and, we're praying folks, not ashamed to say that. And I'll just say God answers prayers. Just leave it at that. God answers prayers.
Honey, do you have any parting words?
I do. I just want to make sure that men are very proactive in terms of this prostate health question. Get your PSA test mid-40s or earlier, particularly if you have a family history of prostate cancer. Get that exam, because like I said, if you can catch it early, like thank God, we were able to do, it can be something that's easier to deal with, and it doesn't have to progress to the very, very ultimately more serious stages of it. And so just encourage people to do that.
Okay. And I would say, I would like to encourage all of our listeners to speak with the men and their families about PSA screening. I believe that is what saved my husband, and the reason, why he's still here. And, our physicians, our guests, they've all recommend, as Elle mentioned earlier, to get that PSA screening around their mid-40s. And for men who have a history of prostate cancer in their families, even earlier. It is our goal that we don't want men to die from untreated prostate cancer due to a concern over sexual dysfunction. We want men to live. We want families to be together. We want husbands and wives to still be together. We want, whether the guy is married or not, there's a partner. We want guys to live. And so Elle and I, even though he was diagnosed with prostate cancer, he's a survivor, and we are yet and still living our best life. And we want that for all the listeners and anyone that's impacted by prostate cancer. I love you, honey.
I love you too. Thank you so much.
To find out more information on the guest you just heard or previous guests and a list of Prostate Cancer Real Talk episodes, visit our website, prostatecancerrealtalk.com. And if you have a question, comment, or if you would like to share your story, send Elle and Shay an email. Elle and Shay at prostatecancerrealtalk.com. That's LEL and Shay, SHAY, at prostatecancerrealtalk.com.